You wake up, walk into your kitchen, and open the small plastic compartments of your daily pill organizer. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. A third to thin your blood, and maybe a little something for your mood or your joint pain. You fill a glass of water, throw the entire handful of pills into your mouth and swallow them down. You feel a sense of security. You absolutely trust the medical system. You assume that because a highly educated specialist prescribed these drugs, the terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour, perfectly balanced, and is 100% safe. But what if I told you that this absolute trust is the most dangerous assumption you can make after the age of 60? The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour, where the left hand has absolutely no idea what the right hand is prescribing. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour, relying on software alerts that are frequently overridden or ignored. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The trigger was a lethal, invisible chemical collision happening directly inside their own bloodstream, a toxic mixture of incompatible drugs that never should have been swallowed on the same day. Today, we are going to expose the terrifying epidemic of polypharmacy. I am going to reveal 4 highly specific, incredibly common, and absolutely deadly drug combinations that seniors are taking right now, and how mixing the wrong antibiotic with your heart medication can literally stop your heart in its tracks. And how mixing the wrong antibiotic with your heart medication can literally stop your heart in its tracks. I will give you the exact vocabulary you must use to force your pharmacist to do their job and protect your life. Before we dive into the volatile chemistry of your medicine cabinet, I must issue my standard, incredibly vital medical disclaimer. This video is intended strictly for educational purposes. I am a doctor, but I am not your personal physician. The pharmacological reactions and catastrophic internal damage we are about to discuss are based on extensive peer-reviewed medical data, but every single human body metabolizes drugs differently. Under no circumstances should you ever use the information in this video to abruptly stop taking any medication that has been prescribed to you. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. Use this knowledge to educate yourself, to understand the profound systemic power of the chemicals you ingest, and to become a fierce, unyielding advocate for your own safety. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour, enters your bloodstream, and saturates every single organ, tissue, and cell in your entire body. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. When you take multiple drugs at the same time, they are thrown into a brutal, microscopic cage match. They are forced to fight for the exact same chemical pathways. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. If 2 drugs have similar side effects, they compound upon each other, turning a mild risk into a guaranteed biological disaster. This brings us to the first, and perhaps most widely ignored, dangerous combination on our list, the bleeding brain. This is the lethal mixture of SSRI antidepressants with common over-the-counter NSAID painkillers. Millions of older adults take antidepressants like sertraline, escitalopram, or fluoxetine, commonly known as Zoloft, Lexapro, and Prozac. These drugs are selective serotonin reuptake inhibitors. They work brilliantly by keeping more serotonin available in your brain to stabilize your mood. But serotonin is not just a brain chemical. It is an absolutely vital component of your cardiovascular system. Your blood platelets, the tiny cells that clump together to stop you from bleeding to death, rely heavily on serotonin to function. Because SSRIs alter serotonin levels throughout your entire body, they inadvertently deplete your platelets of the chemical they need to form a solid clot. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. You go to your medicine cabinet and take a high dose of an NSAID, a non-steroidal anti-inflammatory drug like ibuprofen, naproxen, or Aleve. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. When you combine a daily SSRI antidepressant with an NSAID painkiller, you are creating a perfect, catastrophic storm. You are burning a chemical hole in your stomach lining, while simultaneously hitting your blood platelets with a devastating 1-2 punch that completely destroys their ability to plug the leak. A massive, comprehensive study published in the British Medical Journal reviewed the records of thousands of patients taking this exact combination. The researchers concluded that combining an SSRI with an NSAID drastically multiplies the risk of a catastrophic upper gastrointestinal hemorrhage. You can literally bleed to death internally in a matter of hours. Even more terrifying, this exact same mechanism drastically increases the risk of an intracranial hemorrhage, a bleeding stroke inside the brain. If you are taking an SSRI for your mood, you must treat over-the-counter ibuprofen and naproxen like toxic poison. You must manage your joint pain with safer alternatives like acetaminophen under the strict guidance of your doctor. Combination number 2 is a terrifying trap that frequently occurs during the winter months. I call it the heart stopper. This is the deadly mixture of ACE inhibitor or ARB blood pressure medications with a very specific common antibiotic known as Bactrim. If you have high blood pressure, there's a massive probability you take a daily medication ending in PRIL, like lisinopril, or SARTAN, like losartan. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. Because you take this drug, your baseline potassium levels are naturally sitting higher than a normal person's. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. Bactrim is a brilliant antibiotic, but it holds a dark chemical secret. The trimethoprim component of the drug is structurally identical to a potassium-sparing diuretic. When you swallow Bactrim, it travels to your kidneys and acts like a chemical barricade, physically blocking your body's ability to excrete potassium into your urine. You have just mixed a blood pressure pill that hoards potassium with an antibiotic that completely barricades the exit door. The potassium has nowhere to go. The levels of this electrical mineral in your bloodstream violently and rapidly spike into the toxic zone, a condition called severe hyperkalemia. The Canadian Medical Association Journal published a highly urgent warning regarding this exact interaction. When your potassium levels spike too high, the electrical signals in your heart muscle become chaotic and uncoordinated. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. You are sitting in your living room taking an antibiotic for a simple UTI and your heart simply shorts out and stops beating. If you take lisinopril or losartan, you must interrogate every single doctor who hands you a prescription for an antibiotic, and you must explicitly ask if it is Bactrim. Combination number 3 is perhaps the most frequent undocumented pharmacy error in the entire medical system. It is the statin overload. This is the dangerous mixture of statin cholesterol medications with specific calcium channel blockers used for blood pressure. Statins, like simvastatin or atorvastatin, are processed and cleared out of your body by one specific heavily overworked enzyme in your liver called CYP3A4. If you take a 20 milligram pill, your doctor knows exactly how fast that enzyme will break it down to keep the drug levels safe. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. These drugs relax the blood vessels and ease the strain on the heart. The massive systemic problem is that amlodipine and diltiazem are notorious chemical bullies. They go straight to your liver and aggressively demand to be processed by the exact same CYP3A4 enzyme that your statin relies on. But the blood pressure drugs are stronger. They hog the enzyme. They essentially push the statin to the back of the line. Because the liver is too busy breaking down the amlodipine, the statin is never cleared out of your blood. You take another statin pill the next day, and another the next. The Journal of the American College of Cardiology has documented that mixing these drugs can cause the concentration of the statin in your bloodstream to skyrocket to massive, highly toxic levels. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. You will wake up feeling like you just ran a marathon. Your legs and back will ache with deep, agonizing muscle pain. This is the beginning of rhabdomyolysis. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. If you take a statin and a doctor adds amlodipine or diltiazem to your daily routine, you must demand that they drastically lower the dose of your statin to compensate for this severe liver blockade. Finally, combination number 4 exposes the most dangerous, unregulated aisle in the entire pharmacy. I call it the herbal hemorrhage. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. There is a massive, fatal misconception among seniors that if a supplement is natural or derived from a plant, it is completely harmless. But plants are simply chemical factories. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. Your blood is just slippery enough to prevent a clot, but thick enough to stop you from bleeding to death if you bump your head. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. You are introducing massive, highly potent antiplatelet agents into your blood. These natural herbs aggressively thin your blood. When combined with a prescription blood thinner, the synergistic effect is catastrophic. Your blood becomes the consistency of water. A minor slip and fall in the bathroom will result in a massive, unstoppable internal hemorrhage. Conversely, the popular natural antidepressant supplement, St. John's wort, does the exact opposite. St. John's wort is a massive enzyme inducer. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. If you are taking Eliquis to prevent a stroke, the St. John's wort forces your liver to chew up and destroy the stroke medication before it can even protect you. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. If you are on any prescription blood thinner, the entire supplement aisle is completely off limits to you without explicit written permission from your cardiologist. You must treat vitamins and herbs with the exact same fear and respect as a Schedule II narcotic. I know that reviewing this list can make your daily pill organizer look like a ticking time bomb. The sheer volume of chemistry happening inside your body right now is overwhelming. But you do not need a degree in pharmacology to protect yourself from these fatal collisions. You simply need a rigid, uncompromising system. You must force the medical professionals around you to do their jobs correctly. I have developed a highly specific defensive protocol to help you navigate this broken system. I call it the Pharmacy Defense Protocol. These are 3 mandatory, non-negotiable steps you must take to ensure your daily medication list is saving your life, not quietly destroying it. Step 1. The Single Pharmacy Mandate. This is the absolute foundation of your survival. The greatest danger to a senior is fragmentation. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The computer systems do not communicate with each other. No one is watching the complete picture. You must transfer every single prescription, without exception, to one single dedicated pharmacy. When all your pills are actively loaded into one centralized computer profile, the pharmacy's interaction software will automatically flag any deadly collisions before the pills are ever handed to you. Step 2. The over-the-counter interrogation. You must fundamentally change your behavior inside the drugstore. Just because a drug is sold without a prescription does not mean it is safe for your unique biochemistry. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. I am taking these 3 prescription medications. Is this over-the-counter product 100% chemically safe to combine with my specific daily pill list? Pharmacists are the true, undisputed masters of chemical interactions. Force them to verify your safety. Step 3. The annual deprescribing audit. More medicine does not equal more health. Every single year, you must gather every pill you swallow, prescriptions, vitamins, and painkillers, and put them into a brown paper bag. Bring this bag to your annual physical. Empty it onto the doctor's desk and demand an audit. Ask them specifically, which of these medications are absolutely vital for my survival today, and which of these am I taking simply because another doctor prescribed them 5 years ago? Your body changes, your weight changes, and your kidney function declines as you age. A drug that was safe at 60 might be highly toxic at 70. Actively work with your doctor to deprescribe and eliminate any pill that is no longer chemically necessary. Your life is a brilliant, delicate balance of chemistry. The terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. You cannot mix them blindly. You cannot assume the system is protecting you. You have the power to take control. You have the power to organize your care, ask the hard questions, and completely eliminate the risk of a fatal pharmacy error. I strongly, urgently implore you to share this video. Send it to your spouse, email it to your siblings, or share it with your local community groups. Polypharmacy is the silent killer of the elderly. Millions of seniors are taking ibuprofen with their antidepressants, or mixing dangerous antibiotics with their heart pills, completely unaware that they are setting off a chemical bomb inside their own bodies. You have the power to save a life today just by passing this list along. If you found this unvarnished truth about medication safety valuable and you want to continue learning how to fiercely protect your health as you age, the terrifying reality is that your pharmacist is completely overwhelmed, processing hundreds of prescriptions an hour. Before you leave, please drop a comment down below. Tell me, do you currently get all of your prescription medications filled at the exact same pharmacy, or do you use different pharmacies for different doctors? I read your comments constantly, and your experiences help me decide exactly what vital topics I need to research for you next. Use the information I have shared today as a starting point for a serious, informed conversation with your healthcare team. Do the pharmacy audit this week. Thank you for your time today. Take care of your heart. It is the only one you have got, and I will see you in the next video.